My name is Victoria Vega, and I'm a music therapist for the last 3 decades. I started my education actually in music education at West Virginia University. And during my student teaching at that time, they started to mainstream the special children into the music and art classes. And I was very interested in working with the special children with the special needs in the classroom. I heard about music therapy, and at the time there were only 7 master's programs in the United States, and Loyola being one of them. Also, when I did some more research, I noticed that the professors at Loyola were avid researchers and very well known. So I came all the way down to New Orleans, and I came to Loyola University and received my master's. A few years ago, I went to Temple University and received my Ph.D. in music therapy, and I was the 3rd to graduate from that program. There's only a handful of us in the United States with a Ph.D. in music therapy, and I'm very proud of that. Music therapy is basically using music to aid a person to be the best they can be in this life, whether they have cognitive issues, communication, social, emotional, or motor. For instance, I used to work primarily in physical rehab. My forte is in head injury and stroke. So I might have a client that's in a coma, emerging from a coma, and I might use music to elicit consistent responses to the environment. If they're further along, I might use music in songs, lyrics to help with orientation and their cognitive growth. I might use music to play instruments to increase fine and gross motor skills. I would use music in a group setting to help with social emotional skills. So these are some of the ways that we use music therapy. What makes a good music therapist, that was part of my dissertation research. And also from being in the profession for 30 years, a person that is a people person is a definite must. Also someone that has empathy and can kind of put themselves in someone else's shoe and realize that their behavior, what they're exhibiting, has to do because they're sick or they have a syndrome or a disease, and it's not that they're acting a certain way or have a certain problem just because they're giving you a hard time. And of course you have to be a wonderful musician. You can't be a music therapist if you're thinking about what is that chord I'm playing, or I don't really know this song, and thinking about yourself. A good therapist thinks about the client first, puts the client first. So in doing so, the music has to be kind of almost like by rote for you. You can't be concentrating on your part into it. One of the times I was working with a young man who was in a coma, and he wasn't responding to any treatment. And one day I was playing my guitar, and my guitar was rested up against his thigh, and I was playing his favorite song, and he slowly turned his head and eyes and looked at me as I was playing. And that was the first consistent response he had to anything. And having that happen in the music therapy session was really wonderful, to be that present with him that he did that. And then of course the family members were there, and they were just ecstatic. And he did, through music therapy and the other support therapies, he did walk and talk out of that rehab center. One of the ways we get the student up to speed in working with people with a variety of disabilities is for them to also work on themselves, understand what their pressure points are, what their strengths and weaknesses are, not just as a musician, not just in formulating activities and interventions to do with clients, but also personally, where they come from, their family of origin. Those things are important, and it's important to know yourself very well before you can reach out and help others. So that's part of the process that we work with here at Loyola. We are very close to our students here at Loyola. It's pretty much a natural given. Well, one of the things that's wonderful about Loyola is we have smaller class sizes so that we're able to mentor our students more closely. We see them not only in the classroom for lectures and mock situations, like mock therapy sessions. We actually go out with them into the community and help mentor them in working with clients with different disabilities and challenges. So therefore, we're pretty close to them. Many of the Loyola students keep in touch with us after they leave. Not only do you see them at regional and national conferences, but sometimes they'll call or email and ask for some guidance, maybe in going into a specialty in music therapy, such as guided imagery and music, or maybe looking at graduate school, maybe in music therapy, or maybe in a related field. But it's rare that I don't hear from them. I have a lot of interest, but I think as far as my research interests have been in burnout and longevity of professional music therapists. How do we keep ourselves well while we're still working with all these people with so many needs? It can be very, very draining. And some of the things I've found in my research is that you need to make music for fun outside of what you do as a therapist. Music making with others, music making whether you're playing in church or you're playing in a community band, these things are very, very important, to use music for yourself. That's one of the reasons I went into music therapy. I didn't want to go into a profession where I couldn't use music on a daily basis. And I also wanted to be in a profession where I could work with people daily, because I'm a real people person and I love that interaction with others. So music therapy for me was a perfect fit. There's a lot of ways you can learn more about music therapy, of course, with the internet, but there's musictherapy.org. You can go there, and the American Music Therapy Association has a lot of information on there about music therapy and about where music therapists live, where they work, what types of clients they are working with. There's even some live video on the internet of music therapists working. Another way you can do to get more information about music therapy is to contact someone locally. Through a lot of the major universities have music therapy programs. Get in touch with them, see if they can hook you up with somebody in the community that's a working music therapist, so that you can go and volunteer or observe. If there isn't one, just volunteering through your school or through your church to work with people with special needs is a great introduction. Although you might not be using music therapeutically, you're gaining the knowledge of working with people with challenges, and to see your comfort level in working with these people. Music therapists are trained to perform music in a variety of genres because our clients, in meeting their needs, have an interest of many genres. So you have to be able to play and perform in those, and to have some knowledge of music in different genres. So it's not necessarily all classically trained. We also have to be trained in the popular music. The music therapy curriculum here at Loyola University is very population specific for the first 3 years. Music therapy students come in, and from the get-go, the first semester, they take Introduction to Music Therapy, which is just more of a general, where did we come from, who are our founding fathers, what types of people do we work with. That's basically where we start. But then we get into more specifics. We have gerontology, we have mental retardation and autism, we have the psychological diagnoses classes. So we have classes that specifically talk about the characteristics of each clinical population, what are their needs, and how does music support and help those people. Then our senior classes are more not so much client specific, but more like affect and perception and music improvisation, and then on into the masters. Loyola has the 7th oldest undergrad and the 3rd oldest graduate program in music therapy in the United States. When you're progressing from the undergrad to the graduate level coursework here at Loyola is pretty even-keeled. It's advanced clinical training as well as research-based. So we're teaching our students how to be researchers in the field, mostly in the quantitative paradigm, And we're also teaching them how to be advanced clinicians, also future educators and supervisors of students out in field work, whether it's under the academic program or it's during the 6-month internship. We also train in supervision. The Ph.D. level, of course, is not offered here at Loyola, but my Ph.D. level was, again, I felt pretty even in advanced clinical theory, supervision and education, as well as research, both quantitative and qualitative. This year, music therapy is celebrating 60 years of being an organized entity here in the United States. We have more jobs than we have therapists. If you want to work in a more rural area, jobs are more difficult. Most music therapists work more in a metropolitan setting, but we work in hospitals, rehabs, jails, schools, and I could go on and on. I have such a wide variety of music. It might be rhythm and blues, it might be 70s music, it might be opera, or it might be new age music, depending on my mood, and if I want to use it for relaxation, if I want to use music to sing along with, or if I want to use music to dance with. I definitely hope to still be here at Loyola University. I enjoy mentoring the students at this level, at the undergrad and the graduate level. I also am still a clinician. I work part-time out in the New Orleans area as a music therapist, and I find that it's very important so that my skills don't get rusty, and also that I keep realistic in what is the type of clients that we're working with, because that certainly has changed over the years. When I first came here to Loyola, basically music therapists work with older adults, mental retardation, and they worked with psychological disorders. And now anyone with a health need from NICU all the way up to the well elderly and everything in between is what music therapists work with. So I think it really keeps me fresh to continue to be a clinician. When the music therapy student leaves here with the undergrad level, bachelor's level, they are trained to work with a variety of clinical populations at the augmentative level, and I hope that they find their niche. You cannot do everything perfectly and work with all populations well. So hopefully they will gravitate towards what fits best for them in their personality, and their philosophy of life has a lot to do with where you end up. I certainly started working with psychology and diagnoses in psych patients, and then I gravitated to physical disability, cancer, and syndromes and diseases that were pretty rare in the United States. And through that, I gravitated towards rehabilitation of the stroke, of the head injured client, and that ended up being my forte, but I gravitated towards that. As I learned more about the profession, as I learned more about myself, as I matured as a person, that's where I gravitated to, and that was my niche, and that was perfect. So I would hope that my students realize that when they get out there, they're probably not going to be working with their niche, their perfect match, that they realize that it's a journey and that they will gradually find their way, and they will gradually work with the clinical population where they can be most effective with.